This segment is sponsored by iChiro Clinics. As time goes by, some things that used to be easy for us can turn into a struggle, like bending down to retrieve a pen or reaching for the top shelf of your cupboard. And Dr. Kwast is here today to tell us why we shouldn't take those restrictions very lightly. So I know you see this all the time in your line of work over at iChiro. Talk to me about that straw that breaks the camel's back idea.
Yeah, so many people come in with problems that could really have been addressed sooner. They just didn't know what to look for because they were waiting for maybe like debilitating pain or something bad, or they just thought it would just like go away. And sometimes it does. However, when you see any kind of range of motion restriction, meaning that you're tight and stiff and can't do certain activities, so like you said, reaching for something, or even just turning your head. So people who are like driving and then they go to do a head check and they notice that it's harder or tighter. Or we had a patient and he said when he got in his car he couldn't bend to get in and he would bump his head every time he got in. Wasn't having a lot of pain, but knew that stiffness was a problem, because then that leads to a higher chance of injury and higher chance of getting arthritis in those joints. And there's lots of stuff you can notice that with, even like golf swings. You'll see people who are golfing and then they get that short, compact little jerky swing and the ball doesn't go anywhere. It's because they've lost range of motion. And then they just blame it on age, like that is like acceptable. Because there's things you could do. It's just people don't know or they don't understand. So we're trying to get people to know and understand, because if you take a person who has restricted range of motion, we can restore that motion. We track the progress to see where we can get it to, and then we actually see less injuries, less arthritis, better function, better mobility, and like, who doesn't want that?
Right, of course. And I know that there are some people probably sitting at home right now thinking, I mean, sometimes it hurts when I do this, or I guess maybe I could have a limited range. Do you have any way that we can like measure that?
Yeah, so the cool thing is when we see people, we actually do all of the range of motion tests as part of our evaluation to find out, because then we need to document those range of motions so that we can then in the future redo them to see what kind of changes we're making. A simple one that I could just show you is range of motion of your neck, which we can actually, you can measure that pretty easy. If you just put your hand on a person's shoulder like this, they should be able to turn their head and line their nose up with my hand, and you're able to do that, which is good.
How embarrassing would it be if I wasn't able to? Guys, I'd be dying right now and we'd all find out.
But those are just simple checks that we do, and then what you see is people, a lot of times they'll start to lose a range of motion, and because it's not like super bad pain, they don't really care about it. What they're not realizing is now your injury chance goes way shooting high, and that compression, the muscle tightness that's preventing the motion, the compression in the joint will cause that joint to actually deteriorate, which is called degenerative arthritis. And that stuff can be largely prevented, halted, and then you can get your mobility and function back, which gives you a better quality of life so you can do the things that you actually want to do.
So talk to me about how you give folks that quality of life over at iChiro.
Yeah, so basically by doing that initial evaluation, documenting all the tests, and then retesting people, using all the different therapies available to us, from massage therapy to the computerized adjustment to manual adjustments, I mean, whatever the patient needs, stretching, exercises, all the different nutritional things you can do, changing your diet, getting you in a yoga class. I mean, there's a lot of things that we can do to really empower people to be able to take charge of their health and not just walk around suffering and then end up in some nursing home when that could have been a preventable thing.
Right,
you know, you'd
absolutely.
be at home.
Absolutely. Well, Dr. Kwast, thank you so much for joining me today. And we have got all this information, including how to connect with Dr. Kwast online. Just head to our website at 13onyourside.com.